All are present. Speakers. Dr. Smith, yeah, you can come and start your presentation.
A very good morning, respected dignitaries on the dais, my dear colleagues and friends. The topic of my presentation is comparison of long-term outcomes and refractive stability following SMILE versus SMILE Extra. I declare no financial interests. So SMILE was proposed to be biomechanically more stable as compared to LASIK and PRK. However, ectasia was shown to occur even after SMILE, with most of these cases having borderline or preoperative abnormal topography. Extra procedure is the new class of refractive surgery with simultaneous collagen cross-linking. These can be combined with PRK, LASIK as well as SMILE, typically performed in cases where the topographic or tomographic indices or the clinical history is suggestive of at-risk corneas based on the proven evidence that cross-linking leads to halting of progression and corneal stabilization of keratoconic corneas. The hesitation for refractive surgeons, however, is due to the potential risk of haze, overcorrection, and additional costs. While there is growing evidence that refractive surgery with simultaneous collagen cross-linking, in particular with SMILE, is beneficial, there is however a paucity of long-term data on the efficacy and stability of SMILE Extra when compared to SMILE. Thus, this study was conducted to compare the long-term safety, efficacy, predictability, and refractive stability following SMILE Extra. So this was a retrospective study comprising 27 patients in each group who underwent bilateral SMILE and SMILE Extra respectively. SMILE Extra was performed for borderline cases if three of the following criteria were satisfied: age less than 30 years, corneal thickness less than 480 microns, a residual stromal bed thickness between 250 to 280 microns, mean refractive error more than 6 diopters or spherical equivalent, CBM more than 0.5, TBM more than 0.29, and a final D value of more than 1.65. Both the groups were comparable. However, the CCT in the SMILE Extra group was relatively thinner, and the keratometry was relatively steeper in the SMILE Extra group. So SMILE was performed using the standard protocol. For SMILE Extra, 0.1 ml of 0.25% riboflavin was injected into the interface and allowed to diffuse for 60 seconds. The protocol used was 45 milliwatts for 75 seconds, and the total energy delivered was 3.4 joules per centimeter square. This is a photograph showing intraoperative slit lamp diffusion of dye at the end of mean follow-up. 94% eyes in SMILE Extra as well as in the SMILE group showed UDV of 20 by 20 or better. 94% of eyes in the SMILE group and 93% of eyes in the Extra group had a CDVA similar or better. There were no intra or post-operative complications, and slit lamp examination revealed a mild transient haze which was visually non-significant and resolved over time. Thus, in conclusion, SMILE as well as SMILE Extra resulted in comparable visual outcome, safety, and efficacy. Contrary to the belief, combination of prophylactic cross-linking with SMILE did not result in any hyperopic shift over time. No eye in either group encountered post-operative ectasia. Further follow-up, however, is required to establish the long-term effects on the refractive and corneal stability following SMILE Extra, as all the eyes treated in this group were borderline. Thank you so much for your kind attention.
Refractive?
Yes, sir. So, sir, this basically the study is inspired by results on form frustrated keratoconus cases itself. We have published it as a separate series.
What is the follow-up period?
For this study,
Yeah, that for refractive.
so that was 5 years. For this study, the mean follow-up was 21 months, minimum follow-up was 12 months, and the longest follow-up we have is 4 years.
But haze is not a problem.
Yeah, haze, sir, there was haze, as I mentioned in one slide. There was a transient haze in some cases of SMILE Extra, which gradually resolved over time. So no I had any haze more than grade 2, and no I had any haze interfering with vision.
So the longest follow-up you have is of 4 years of
Yes, ma'am.
patients. As
Yes,
the
ma'am.
data you presented was of 4 years.
Yes, ma'am. So the minimum follow-up we included was 12 months, and the mean follow-up was 21.8 months, and the longest follow-up was 48 months.
And the mean age group that you had included?
The mean age?
Yeah.
Yes, ma'am. The mean age was around 28 years.
So they are kind of sort of past the problems of
Uh, you mean for the both the groups? I think mean
SMILE Extra.
yeah, 22.8 years. Sorry, not 28, 22.8 years. So both the groups were comparable with respect to age as well as the spherical equivalent sphere cylinder, also the corneal astigmatism.
And the mean spherical equivalent minimum that you said, or rather, it was not the mean, you said you did more than 6 diopters.
Yeah, so for patients who had a mean spherical equivalent more than 6 diopters, along with, so basically we included 3 criteria. So if age was less than 30 years, in addition to other of the following criteria that I mentioned, with the CBI more than 0.5, TBI more than 0.29, and any family history of keratoconus or habitual eye rubbing, and a final D value on pentagram more than 1.65. Also, the residual stromal bed thickness, it was between 250 to 280, and if the central corneal thickness was less than 480 microns.
Do you not think that they would do better with the PRK than a smile? Why? Like, for the sake of study, I totally understand. But if you as a clinician would want to give them an option, would you not then shift to PRK, or would you still go
Ma'am,
for Smile Extra?
for the advantages of Smile itself, plus we have a high volume Smile center. So these were all based on the patient's preference. When we plan a patient for refractive surgery, we give them all options: PRK, LASIK, as well as Smile. So based on the patient's preference, they select.
So you are convinced that Smile is biomechanically more stable than the other?
No, because I have worked on even PRK, LASIK, as well as Smile studies. So even PRK has very good biomechanical stability.
Most
Yes,
amongst
yes,
the
yes, ma'am.
Thank you. It was
Thank you,
good
ma'am.
study.